1, 2, 3, 4, 5. Testing, testing. English channel. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Can you hear me, Joao? Is that okay? 1, 2, 3, 4, 5. Moving to the French channel.
Ils vont afficher. Oui, oui. Non, non. On va vous appeler, vous allez venir ici. Bonsoir tout le monde. Il est exactement 14h40 et nous allons pouvoir commencer notre séance. Je voudrais d'abord vous souhaiter.
First of all, I would like to welcome you to this panel, which is consecrated to sanitary democracy. And I am Dr. Mongo In of the West African Organization of Health, which is the health institution for the economic community of the West African countries. Actually, this is, well, what it represents for the United Nations system. We represent CDAO. The mandate that the 15 heads of state have given to the OAS concerns the harmonization of the health norms and the mobilization of resources, and also they are making them common and also prioritizing access to health through high impact programs. We have responsibilities, and well, I have the responsibility to moderate this panel, and I'm going to respect the time, and I'm going to count on you so we can succeed in doing so. Sanitary democracy, main elements of the definition, and what are the requirements to their success so we can increase quality health, including sexual and reproductive health, especially of the youth and adolescents. So Burkina Faso, Mali, and Niger are going to speak about the models on which sanitary democracy can be broken down in practice on the field. But before that, we are going to have, first of all, an outlook about what sanitary democracy is, and I'm going to invite Kayose, who is the coordinator for advocacy of Keep Up, which is the implementation organization that has conducted the works in the field. Kaya is the specialist that accompanies the team for the elaboration and also the mobilization of actors in the field, and also the active engagement and conscious engagement of populations with regards to health activities that concern her. I have the pleasure, therefore, to invite Madam Kaya to present about sanitary democracy, and after that we will have the three countries that are going to be sharing their experiences with us. And thank you. And I will ask you for a round of applause to welcome Kaya. Thank you, Dr. Reeve. Thank you, everyone, to be there today. Very briefly, I'll try to clarify a little bit what covers the concept of sanitary democracy. And our partners here will help us to illustrate how this is specifically implemented. So the idea of sanitary democracy concerns thinking at the same time the power relationships and the knowledge with regards to policy matters in terms of health. This is a formality that concerns processes and the reflection about these in terms of health sanitary policies through dialogue integrating the different stakeholders. And in here, the idea is to have a framework in which public action in health is debated, uh, elaborated, and assessed with all of the stakeholders. And when I say the stakeholders, that goes from health providers, sanitary authorities to up to the citizens and health services users. So that's the idea of this dynamic. And we have to replace the human at the core of this health system with the idea that healthcare has an advantage at an angle of relationship instead of one of management. This entails, of course, several requirements. That is the exercise of citizenship. We have at the same time to know our rights. The example we are going to be using through citizens that represent the youth and their engagement in the definition of health policy, especially those concerning sexual and reproductive health, the right to education, to representation, and the right to participation. And actually, this is about acknowledging the expertise of all the stakeholders and that there is no knowledge more important than in another one, and we have to take into account here in the definition of public policies. And actually, citizens, well, we see the chapters at the same title that authorities or health experts. That's the main lines around this, and this means that we need to activate some levers that are the knowledge of one's rights or the rights of the youth, so we can strengthen this action capacity to question power relationships and the idea of a mutual accountability. That means that public authorities are accountable before the citizens with regards to health, the implemented health policies, and we have to hold them accountable, and we have to exercise a citizen control over them. That's what I had to say as an introduction with regards to sanitary democracy. Thank you very much. I think that we can thank Madam Kaya. I have to say that sanitary democracy is a new concept that generates a lot of curiosity. She has just made a global introduction thereabout. Sanitary democracy demands that population takes a conscious, active part in it. With regards to everything that concern policy and strategy around health, that the power can elaborate for a specific population, taking into account this in the implementation and especially in the evaluation and especially for accountability to exercise this citizen control. We are going to move on now, and we are going to go to the three different countries that we have here. I'm going to see the practical aspect of the sanitary democracy in the field, and I'm going to invite Dr. Ben Mulai, who is the Director General of the National Bureau of National Health and Reproduction. He is a specialist in public health with over 20 years of experience, especially with an expertise, approved expertise in matters of reproduction health programs management. He is going to be presenting the specific case of Mali, known under the denomination of a tool of consultation about the rights in matters of reproductive and sexual rights of the youth and adolescents at the model of sanitary democracy in Mali. We are going to ask the technicians back there to display the doctor's presentation. It's presentation number 2. There we go. Thank you very much, Dr. Bett. The floor is yours. Thank you very much. Even if the microphone is an important actor here, I'm going to excuse myself. We are going to be, well, even if microbes are an important problem here, I'm going to be using the same microphone. So thank you for giving me the floor and for the invitation to come to speak in this assembly about sanitary democracy in Mali. As you know, LITUMET is a tool for the government action by civil society. It's the indicators of the production indicators, especially those of reproduction health in adolescents and the young, that for 10 years Mali is organizing itself. First of all, the civil society, the programs and plans to be implemented. And well, we are going to have here important tools capable of realizing these plans and projects, is in the sense that the National Bureau of Reproduction Health has been created. And in all of this, Mali has also assumed its engagements 37 in matters of SSE, and in this 35 we have 16 engagements that interest adolescents and youth. It's around this dynamic that the civil society has organized just to simply make the government speak and bring the government to speak to the adolescents and the youth through a platform of accountability. So here we have the platform, the 16 engagements, and this is a dialogue framework. The CSOs of the youth at the state and of the Mali government are targeting these goals. This platform is also going to be displaying indicators and the level of the execution and of the execution of the engagement. So in here, in an accountability relationship that I was evoking a moment ago, concerns here trust and dialogue. And here we have a consortium for CSOs, and we speak here about CSOs and 3 organizations of CSOs that are there, so we can build this platform in spirit of co-construction with authorities and the youth movement. The organization of several candid dialogues between the different stakeholders, the construction of a common reference that is a collective choice of these engagements, and we have to agree on the indicators of these engagements, and we have to implement a piloting committee presided as well by the government. A transformation of the authorities' practice of health. We have a tool here that has allowed health authorities to evolve their dialogue and consultation format with the CSOs and the exercise rules of sanitary democracy, rethink the role of the youth and their place in sanitary governance, strengthen interministerial collaboration. And what I mean by that is that, first of all, we can think that this is a tool to call the government to action, a tool for self-assessment as well for the government. So what we have to retain to activate this sanitary democracy model is to develop impartial consultation program that has the youth, the civil society, the authorities to establish a common dialogue with around the engagements, as I said, so we can have a common reference, and we have to install a trust environment that will allow these young to say, "Oh, Mr. Director, Mr. Minister, this engagement, we are back in terms of its implementation." So this is just for the organization of the framework and to assure ordinary and the sustainability of the programs. So this is a tool for the government to self-evaluate, for the youth to acknowledge their role, and so finally engagements are respected. Thank you very much. Thank you very much, Dr. Ben. Then now this was the case of Mali. We saw the model that has been used there in terms of sanitary democracy and in terms of engagement follow on by the state, so we can hold it accountable with regards to the respect and the implementation of these engagements. After Mali, I'm going to invite Burkina Faso, represented here by Usman Draogo, who is the president of the administrative council of the consortium, who is very active in the field of SSRC. Mr. Usman is going to present the Burkina experience, the other model of sanitary democracy that has been experimented in Burkina Faso, and he's going to tell us how this has favored the expertise of the youth and their skills, and to strengthen their power in terms of policies, assessment, reproductive and health policies that concern them. Mr. Usman, the word is yours. Thank you very much, Mr. Facilitator. I know it's very difficult to pronounce the name. And Burkinabé has two languages. People of Burkina really comes from the Mambara language. So it's just for the defense of rights. And we have to say that regarding Burkina Faso, our approach to engage the youth in such a sanitary democracy, as it was very well described by Kaya, well, we focused on the social aspect, which is a very innovative, and that highlights the appointment of young girls and also the leadership, so we can advance matters in health that concern them. So, if well, my those are the three axes around which my presentation will revolve. We have context, processes, and tangible products taken from our intervention to say that at the level of Burkina Faso, we know that the SSR are also part of priorities at the level of our references, political references. Knowing FP and the right to it is going to accelerate a demographic transition. At the environmental level, we have to say that the country adopted many laws, starting number 661 against violence against women and girls. And that's the engagement by the government, by the country. We have Maputo and Ouagadougou partnership FP 2020, but in spite of these, an important share of the population, 67%, are still facing a lot of difficulties in the region with all of these problems that we see with the last point that was in 2016. If that's the state of health found by the youth and identity and child marriage for the people of Burkina Faso. In terms of response, I have to say that we have a lot of initiatives by the state, and what we realized was that we do not place the youth at the core of action. These are decision-making spaces that are going to exclude the young girls, and in our reflections, our strategic reflections with our key partners, We wanted to develop an initiative around social audit, which is going to place the young girl at the center of action, which is not just a passive will, but so they can really play a role at the level of democracy, of sanitary democracy. Now, the process has a different stages. So we have a first one that concerns the reinforcement of recruitment, and it's everything that concerns the environment of the country, the political questions, the questions of the programs, the engagements, and the implementation level of these engagements. Then we have the audits that took place at a session with the accompaniment of the population, clearing to for the establishment of a strategy for this and also strengthening of the analysis of the environment. At the second stage, we conducted the social audit, starting by strengthening the background and the methods and techniques. So the interview focus, observation. So what's important, and also we gave them a smartphone so they could collect information based on the digitalization of tools around the Kabukalik software and under the supervision of technicians and through a program for coaching. And also, we engaged them throughout the processes of data synthesis and analysis. At the end of this exercise, well, we were able to use these results to develop what we call the false process with an accompaniment of professionals, and we developed these false processes and to diffuse them and call to the attention of the national opinion with regards to the sanitary matters of youth.
In order to build the capacity of these youth, in order to give them all the necessary eloquence that they need to express themselves to their audience. And so this process has been disseminated in various channels of communication. And all these just to enable us reach the achievement of the call. And for this call, it is the young girls who do the work. And then also they report back on the outcomes of the social audit. And so they have to really undergo the necessary pressure, and the necessary authorities also placed before their responsibilities in order to ensure that they take the necessary responsibilities, and then also for the regional organizations as well, and especially for this latter, to have a further organization of the health of the youth. And all these are done with the support of the entire population that had supported us since the diagnosis of the management of the learning for changing behavior. As a result, as a kind of a result, what we can retain is that we really try to own all that, and then also to have the necessary consequences to be able to diagnose all the sites with all their necessary commitments, and then equally with regard to audit based on advocacy and the mastery of the oratory techniques. And then also these health agents are more sensitive for these recommendations, maybe because it's coming from the youth, I don't know. But it has already led them in Bobo here to take the necessary steps to see how they can improve upon services. And then also this audience comes out with their own models. And we also have certain sessions that concern their capacity building in their session training, as we have here on the slide. And then equally, and then in terms of learning or lessons, we realize that it's a real important tool as a social audit. That gives the opportunity to the youth to really look at building up their own judgments, and then also bring out various forms of evidence in the case of any violations. And then also in case of the entire target audience, they especially look at their creativity. Their collaborations with their people also leads to the commitment of the youth. Thank you for your attention. Thank you very much, Usman. I think we can really applaud him and lead him to sit down. Usman has really clarified us on the other way of exercising this health democracy or sanitary democracy, and especially to the youth, in order to have an appropriate reading of the situation, and then also bring out what works, and then also what has not worked well, and then also call on people to work on it. But then he laid emphasis, specific emphasis, on the way of empowering these youth. And when you would follow the discussions, you have the opportunity to come back to expand further on his presentation in terms of his responses to the questions. The last presentation by Edwin will be done by a young lady, Abubakar Zakari Safiatu, a young activist who has developed in the associative movement in order to contribute to the enhancement of the young Nigerian girls through the defense of the rights of the latter to health, sexual health, and reproductive health. He will talk to us about Yamajari project, which is an example of an exercise to really um, scale up locally or nationally, and how she did it and how that worked, what outcomes that has given. Safiatu will now uh, give us her presentation. The narrative has been questioned a lot, especially uh, this has been integrated in especially in terms of parenthood, conjugal life, and childbirth. Natalie Zakaria Safiatu, you have the floor. We thank the facilitator and in terms of the modest personality he has presented. I'm representing the model of Niger with regard to the exercise of the health democracy or sanitary democracy. This exercise was experimented through Jamajari project, which is a project that targets the promotion of a better organization of the family in order for this family organization to be profitable for the welfare of society. So this is a project implemented by a consortium of 4 NGOs. That is Association of Niger Scouts, then Koje Field, and then also the financing from Wahoo. With the our project was implemented in the regions of Maradi and Tilaberi through the regions of Mayai and Tira. Why the Yamajari project? Let's get a background. In Niger, the mastery of population growth has been neglected, with a whole population that is very young, especially adolescents of 15 to 19 years, who represent 24% of the entire population of the country. 24% of women, and then also in these proportions, we have 61% who are already married, and our percentage of 55% have already begun their procreation lives. And so they had already begun their procreative life, and then you have only 55% that are using contraceptive methods that are modern. So all the difficulties for the state of Niger in order to achieve its fixed goals through the national policy of planning for family planning. And so to be able to really remedy this problem within the framework of this project, there is a citizen movement that was established to rebuild the social standards, which is supposed or prejudged as an obstacle towards the achievement of the objectives in terms of family planning. So, the Jamajari project has as an objective to lead people, influential people of regions of Maradi and Tilaberi to reconsider their position on family planning in order that they would be guided towards a better mastery of fertility by basing themselves on the family dividend and the social welfare. So, as a stakeholder, how did we mobilize ourselves around this project? We had religious leaders and customary leaders, the prefects, the technical, deconcentrated officials of the state, the mayors, artists, and the griots, and then even the various radio presenters, and parliamentarians in the areas of intervention. Why were these leaders prioritized in the implementation of this project? It is first of all to say that they are in permanent relationship with the projects, and so they know the realities of these projects. And they are also heard, for they have a great power of influence on the entire population. Now, to be able to build and disseminate the new narrative on this family planning, we went through the following steps. Collection of data. Data collection was done to gather all the various perceptions of the communities, and then a whole reflection committee was put in place in order to develop a whole argumentary, an argumentary that deals with breaking down all the poor conceptions on issues of childbirth and then also maternity. Then we also had training in order to build capacities for these various arguments. And then we equally had various mobilizing events through which various caravans and then also space for debate was also done. And then before that, the last step, there was the establishment of artistic works, of which we had songs and uh, sketches in order to mobilize and then also uh, mo- uh, motivate the entire will of the people. And there was also radio um, transmissions that was produced and then broadcast by the FM radios. And based on this, we had to also meet for advocacy with the local authorities. Now, what were the results that were achieved following the implementation of this project? We can note more than 20,000 people mobilized in this particular aspect of work by the policymakers in order to forward the message of the argumentative. And so these are influential people who were convinced by the arguments and then also contribute to disseminate the entire arguments. So here we have commitment, a popular commitment of mayors in order to insert budgetary lines in the planning, in the investment and annual investment plan in order to continue sensitization activities. There's also the question of change of discourse or change of speeches, especially with the family heads, in order to space their childbirth and equally look at the number of the choice of a number of children. Then we also had a better reception by the population or the people, and then also with regard to the messages of the entire argumentatives. And then also the popular um, coverage of the message that is requested for through the messages and the artistic works, and especially that led to bring in the people to listen to the messages that were given to them and take them seriously. So this is the experience of Niger with regard to health democracy. Thank you very much for your kind attention. Thank you very much, Safiat. Thank you for having shared with us briefly their experience of Niger in terms of the exercise of a health democracy. Ladies and gentlemen, we have just seen a whole general overview on health democracy and in practice the experiences of three countries. So, if we are here, it is to discuss and share experiences and then also learn from one another and then also equally retain something to also replicate. It is in this direction that I'm going to ask each of the panelists to come in quickly in 2 or 3 minutes to tell us what advice they could give. That is 2 or 3 um, pieces of advice to an institution or a country that would like to adopt and adapt these concepts in their own context. Now, the speakers will take the floor in the same order of speaking. So I shall invite them, first of all, Kaya, to give us 2 or 3 pieces of advice to look at it institutionally. What do we need if we have to implement health democracy? And following that, we have also reserved another part of the time to give the floor to the audience to also speak. Thank you, Dr. Eve. I don't know whether it's about advice or just to enhance this question of activities or actions. We should have in mind all this approach and then also apply it to recenter it on a human being and also have in mind that it's a question of a legal approach and how do we put in place mechanisms and dialogue space between the various stakeholders to be able to advance collectively and that each person or each citizen can exercise his or her right, be it the right to health, the right to information. And this is a work which we saw thanks to the panelists. The question of the breaking down and certain times looking at it in a form of a dimension that could be seen as individual with the youth because you are dealing with the youth, but then there's also a collective aspect. That is to say, at the individual level, is to be able to support the capacity of youth to have a whole awareness of their rights and be able to express them and put in place all mechanisms about capacity building. We saw about training and all that was said. But then we should also bring out on issues of policy this management approach in the way we see it currently, and that it is through our various organizations to be able to try to develop the critical mind among the youth, the capacity of recoiling, and then also develop the necessary competencies to analyze the dynamics that are at stake and brought out by the youth in order to also look at it at the same time in the case of context to let them see in what context that functions and what commitments the authorities have taken, and then also to have the responsibility to act and then also to take the place for them to be more effective. Then another lever that I see as very important is that we should have an approach that is based on legitimacy of the speech of the youth, especially in the context of our various countries, where the question of intergenerational generation issues, and then also the capacity to make legitimate and then also give value to the floor, to the speech of the youth within the space of a decision is very important. It's therefore an idea that we should leave the place, we leave some place for specific expertise in terms of health, but then the experience of a young person for access to health, and then also it's also important, and also we have to consider that the expertise of a whole service provider is very necessary. Thank you very much. Following Kaya, and thank you, Chair. Concerning um, what has just been said, is the same principles. All the others have to have the same understanding of the mechanisms and the principles of the functioning of these particular parameters or this tool that supervises civil society. We should also have a civil society that is well organized. As a young person, should be well prepared with a better knowledge of all the commitments. Once it is a tool that supervises the youth, for them to be able to understand well that states have taken commitments, and these are the commitments, and then also this is their death. This should be a civil society that is better organized. Then we should also have what we call the indicators that we agree with, that the panel of governments and the youth, so you really look at it as indicators to measure. So for this, we can really be
To start assessing together, because it's not an interpolation tool, it's just a self-assessment tool, especially the governmental part, which is going to enhance the youth's knowledge with regards to their role within the government mechanism and that of the civil society, because it's a tool for accountability for the state. Besides all of these, we would need to implement mixed piloting committee that will allow us to establish a dialogue and a discussion framework with regards to the implementation of these engagements, the implications of these, for instance, with the youth in the elaboration of different programs or projects altogether. The young really present in all mechanisms. Are they in the piloting committees? Are they in the technical committees? They really engaged in everything that concerns other accountability frameworks are at the writing committee for plans and projects, yes or no. So we must always assess that when we speak of our engagement with regards to services available for the youth in the public health infrastructures, yes, no, at which level. When I take the example of Mali, it's there's a framework that laid to Metro, the government's Ministry of Health elaborated a roadmap to uh, use the model of pregnant women to address the situation with the youth. But the implementation of this roadmap has different stages as well. You have stage one. So health agents are used to welcome youth, because in here we're going to have a barrier for the youth. So the space that has been created and integrated in the system of maternity or in the system of healthcare, all of these things we have to consider and measure together in terms of the realization of a specific indicator and of a specific engagement. So to say that we have to be able to engage beneficiaries in an ordinary follow-up. We must have a simple dialogue framework, but we must also have governors that really think that the youth and their health is pivotal and a priority. Thank you very much. So in this case of life, a child for the government of Mali, of the Republic of Mali, is a priority, is a priority of priorities. Thank you very much. Thank you very much. We'll have the review this and to go back to the public. Mr. Usman, what are the lessons learned with regards to the engagement of youth in healthcare at the level of Burkina Faso? I think that for the interventions targeting the youth, if we really want to, for this youth to play a role in sanitary democracy, I think that we must be brave enough to trust them, not to act, not to let them act in our place. But I think that right now we have the means, we have the tools and the appropriate approaches to really strengthen their leadership and engage them in the sanitary democracy. As my colleague said, we have helped the youth to master the national health public because, as someone was saying, laws are made for people who ignore them, and we have a lot of laws that are adopted to protect them, and usually the youth do not know these laws. We have a lot of programs in favor of the youth, but sometimes the youth is not really well engaged, so it's a matter of really working on strengthening mechanisms with regards to their knowledge and also highlighting on them a mastery of the tools and what we have once we have changed to this, and they have to be better prepared with regards to the enhancement of their health. The other aspect that I have, and for the other formality of strengthening, we have to work in engagement at all the stages from the concept stage, and we must make sure, like the facilitators were saying, we have to have assessments and let them see that they can play a role at the different levels of our different programs. Thank you. Thank you very much. Safia, you have had the experience with religious leaders. Which are the lessons learned from here that you can learn with the public? Well, we can say that with regards to the experience in Niger, the the lessons learned are the following: through the implication of all the actors, the engagement of all the actors at every stage of the implementation, from the elaboration to the implementation of the project, we can say that the engagement of all the stakeholders represents a success of the project, but at the same time, the sustainability of the acquired knowledge through the citizen mobilization, and also the fact of the taking into account of themes in the collectivities agendas that the councils through awareness raising activities that are sustainable. Besides, as lessons learned, PDF champions and local decision makers speak about, well, in the community, are called to be an important piece in all of these efforts. And then awareness raising through the different, well, through leisure activities has been an important element here. Thank you very much to speak about the important role of local leaders and stakeholders in the sanitary democracy. Ladies and gentlemen, we have completed the first tour. We still have 10 minutes, and the word goes to you, so you can intervene. So I'm going to ask I'm going. First, we have a gentleman over here. You have to take the microphone. May I intervene? Oh, you wanted to intervene. Oh, I'm sorry. I thought you were going to be you had volunteered for handing over the microphone. Oh, okay, okay. Please just to be concise. Thank you. I am Sunny. I come from Mali. I am the coordinator of that project. And for Mali, it's an honor that we have a representative of the government to speak about a civil society's tool. I know, well, it's very normal that he can really defend as a representative of the state to say why such an engagement hasn't been really respected. And I have heard really just Dr. Ben's argument. What he forgot to say is the strategy that the light med strategy has to make to put pressure on the government. Already, people have appropriated this tool either at the formal or informal level, and after this we have another law with regards to reproduction health that does not take into account the needs of adolescents and the youth. Actually, an adolescent who is 14 years old that comes for FOP, the providers do not have the right to offer the right method, just counseling. So the first engagement of our project is the one taken by the government to offer reproduction and health services for free to all the adolescents and youth from here to 2023. And this engagement has an execution rate that is not fully appreciated by civil society. So we say that it's our priority. And what Dr. Ben did not elaborate here is the fact that we have used media people to put pressure on the government, because civil society cannot just say the government has not respected such and such engagement, but we have to shed light on the actions by the government, and we have organized activities, cultural activities, and we have engaged media the way up to the creation of a media network, so we can communicate, have communications about and information about these topics. So this platform must be able to continue its activities and the parallel activities that have allowed to obtain results. And he listed there's that the fact that the mechanisms that are allowed, and I think we are here in a very specific framework, and extension will be able to continue at the best. Thank you. Okay, we don't let her go to the pause. Just identify her, please. Please, and let's be short and concise in our remarks, contributions or questions. Thank you very much. I am from Mali, Dr. Matro, and my question goes to all the countries, because I have had the opportunity to work in the framework of CPO and on adolescents' health. And I was able to work in Niger, and my question in Cote d'Ivoire as well. And my question is the following: where are we in terms of the application of these norms in a health structure? Because these norms, whose responsibility and accountability goes to the decision makers. Well, we have a stakeholder for each, and it's these norms that allow us to appreciate the offer of services at the level of structure. I'm not speaking about political decisions, and neither of the implementation of programs. I'm speaking about a CSI framework. How are these norms applied, and how are we going to assess them, so we can really have an operational center where we're going to have quality services for the youth? Before this intervention, we had a tender process to see where we were in our countries. That was my question. Thank you very much. Okay. Good afternoon, and thank you. My question goes to all the countries, and I wanted to know which method you have used to engage the youth at the level of the different countries. Thank you. Thank you very much. We apologize. We can't hear the question. Since we are in a framework of experience exchange, I would like to ask the Burkina Faso's representative to precise what the difference of false process. But I think that there are people who did not know because he spoke about this topic several times. So we need to see the nuance. What's the difference between a false and a true process? Thank you very much. When we're going to take one last question, and now we're going to give the floor back to the panelists. Thank you very much. Well, before my question, I would like to share a lesson that we had at the level of Benin, which is accountability that has concerned everyone. It's not just the youth who are going to try on their side and are going to ask the engagement to respect the engagement, but also they are going to take engagements for all the actors and all the stakeholders at all levels are going to engage. Everyone has to be accountable for their engagements, and in this way, it's going to be easier for the government, and also before the government is going to, the government cannot take all of the engagement. The time is over. Otherwise, people will come and chase us away. Well, the question is at the level of Mali, is it easy to have consultation frameworks at the national level or at the level of districts? Thank you very much. We just have 4 minutes. Thank you very much. Consultation frameworks that you mentioned at the level of district or national central level. Uh, Thank you very much. Well, then we'll have to start. Well, but really, we have to answer in 1 minute. Everyone has just 1 minute. And then we can continue at the pause, please. Very well, then. I would like to simply start by saying, with regards to the free nature of health services in Mali for youth and adolescents, Mali has already opened a file of for the gratuity of the services. And here we have a dynamic under course. And when we say that it's zero, I think that we have seen the ways. So with regards to the application of norms in the structure, in this health structures, we know very well that in health structures, services aren't in general adapted to adolescents and the youth. The process is that are ongoing have been adapted to this to these services for the youth and the young, respecting them because only when well, only 17% of young Malians have access to public health services. Only 17%, and only 37% have full information with regards to sexual and reproductive health. Thank you. And with regards to engagement, we have different methods. They are very well organized. We have ambassadors, young ambassadors that are really well organized and that are engaged at in all the structures of plan elaboration, piloting committees, and they are engaged in everything that the government does right now in terms of health. The youth are engaged and their voice counts. Now, consultation, well, we're going to organize a national forum every year in which we're going to engage all the young at the district national level. Thank you very much. Very quickly, Osman, with regards to false as we said this, it's not about actual processes of assimilation. It's just a drill. It's a drill, like a fiction, if you want, based on. It's really fictional. With regards to the engagement of all the stakeholders, and I have the question of my sister over there. I think that when we speak about the Burkina Faso's experience, we have a lot of advocacy from civil society to see how we can really engage the youth, the religious organizations, and all the stakeholders in the national level framework. Also, the process of development. This has contributed with a lot of results, and in this case, I think these are key stakeholders in our case. Thank you very much. And well, Seth, with regards to the questions that we were made, the first one which concerns offer of services. In the framework of this project, it was not about speaking only about the offer of services, and it's awareness raising stage, and in the services to have access to healthcare, to which we have the right. I would not know how to answer to you, and the responsible people with regards to NADA who can answer you this question. Right now, a friend, my sister, made a question to know what the stakeholders engagement methods were. We have to make a mapping of influences there. That is all local leaders or actors who are susceptible of an eventual resistance. So to contribute to the development of the plan, we must have a mapping in the targeted regions. So there were already FFP champions and local decision makers and influencers who can influence on other leaders, so they can make them reconsider their position with regards to this question. Thank you very much. Thank you very much. Well, I only have 1 minute to really thank you all to say that we have addressed these emerging topic that is, well, this concept that is really new for us. We have seen the content and the implementation. In three of our countries, we have understood that it's a tool, and sanitary democracy is an appropriate tool for the conscious, responsible, and effective engagement of the youth in policies and health programs that concern them. Thank you very much for your participation, your active participation, and should there be further questions, I would invite you to continue your discussions during the break, and be reassured that in the upcoming weeks, the organizers have promised as well that all of the presentations would be shared with the participants. Thank you very much, and have a nice continuation.